Morning, good
This
afternoon.
meeting is being recorded.
Well, hello, my friends.
Hello.
How are you guys doing today?
Good.
Doctor, how are you?
Oh, living the dream, Dr. Lichoa. Da 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 da. Hello, Mirta. Good afternoon. Gigi.
Hi.
Hello, Saira.
Hi, I'm here.
You driving, Saira? You driving? So, how's it going over there? Anyone has a cool story to share? Anyone wants to share? Mirta, how was your galloping today in the 30s?
That was very good. I'm still alive, as you can see. I had a little hiccup yesterday there, lasering one of the horses. I got 5 staples up on my head, but I'm good.
Wow.
Staples are good.
And they let you work today?
Yeah.
I did. I'm fine. It doesn't hurt, so
No,
it's okay.
be careful. Always with the head, you have to be aware of
Don't be
that.
careful. Don't listen to Dr. Lichoa. He will definitely make you very careful. Just go for it. Be courageous.
That's right.
Be dangerous.
I've been kicked many
I
times.
know
So.
it's just a little. It's a little this big. It's fine. Stop still.
Very good. So, ladies, Zahira has spent a couple weeks with us this year. She has been with us for about 3 weeks, and she's still coming. She's still coming. Zahira, sounds like you are. Did you have a good time today?
I am having the best time and I don't want to leave.
Yeah.
Good for you.
I love it. This is my 7th clinical site and honestly it's been my favorite.
What has been your favorite part since being with us?
What?
What has been your favorite part since being with us?
Honestly, how I'm treated like an upcoming clinician by every single one of them. Honestly, I have so many favorite things. I had a meeting today with school and I was telling them about it. But how one of my biggest one is how I'm made feel part of the team, even if I'm just an extern. Like I get invited to everything, I get included in the meetings, I get asked things, and like I enjoy that I'm getting trusted to like be allowed to do certain things that no one else in any other externship lets me do. The mentorship is amazing. Like I'm learning a lot and also being challenged to think like with Dr. Colton and even Dr. Lichoa. I'll be asked, he was on this treatment, it didn't work, what do you want to do, you know? Like it's just not, it's different from just being in the background. It's very hands-on and I'm learning a lot. Like I'm having a great time.
Glad to hear that. We're happy to have you.
I don't want to leave.
For those of you who don't know Zahira, she is a 4th-year vet student in the veterinary. What school are you in, Zahira?
I'm in Lincoln Memorial University. They're in Tennessee.
Lincoln Memorial University, and we are taking her under our wing and teaching her everything we can within the last 4 weeks. That way, she actually can be a very productive individual.
Yeah, it's been so much fun. I'm excited.
Good deal. Well, it is 6 o'clock in the Eastern Standard Time, and we are ready to kick in. Any questions before I start one of my favorite topics in the whole wide world? No questions.
No.
Okay, good.
Usually.
So, anything, and I know Gigi had some issues with the program, but was that fixed?
Was that what fixed?
You had some.
Yeah, I was told, you know, since I had no problems logging in and continuing
Perfect.
I am, he was like, just ignore that. That could, you know, it's happened before, but it has nothing to do. It's not getting in the way of me doing anything and doing my work. So,
Awesome.
fine. Yes.
Awesome. Good deal. Good deal. Well, I am going.
Hello.
Hey, good afternoon.
Hello.
Yes, yes.
I'm gonna mute everybody now. That way there is no major interruptions. When the dogs start barking on your end. Okay, good. So today, if you have any questions, just raise your hand or unmute yourself or put it in the chat. I'll make sure I follow the chat. But I wanted to talk about oxygen hyperbaric chamber today because it dawned on me that let's see, most of you are actually most of you today are in Florida. And we do have some international students that get the recording of this in other countries such as Africa, South America, and Europe. But the ones in this particular chat today are in Florida. And it is so important to understand that you guys are in a state that has 2 oxygen hyperbaric chambers. And most of the time, most of the veterinarians, most of the equestrians, most of the owners totally forget, ignore that we do have oxygen hyperbaric chambers. And I want to talk a little bit about the physiology so you see why it works. And whenever you have any questions, let's make it very interactive, okay? You can stop me. But first, on the image on the left, over here, right here in this island at sea level, I'm first gonna show you what does the hyperbaric chamber does and what does pressure means. And that's why I have a picture of the beach over here, because I want you to imagine yourself just standing. I don't want you to imagine laying in the beach or in the water or nothing, just standing in the sand, standing in a vertical position, not touch the water yet. And then in the part 2, I am going to take you towards some cases, like this particular one that you see over here, that you don't need to be a radiologist to understand that this horse has a very, very complicated fracture. So without further ado, let's start. First, I want you to know also that if there's anything you do not understand, please look it up, because if you don't look up a word, it's going to start becoming a misunderstood, and that misunderstood is going to pile up, and it's going to prevent you from further studying and further understanding. So if anything is not clear, call me, email me, whatever, anytime we teach, whatever we teach, okay? So check this out. In the 1800s is when the hyperbaric oxygen chamber started. It started with when the workers of coal excavation were starting to feel pain because they were working in the ground, deep inside the ground, in the cave. But when they were returning to work, they were actually feeling better. I just want you to think like that. These are just random stuff, okay? In the Brooklyn Bridge, when they were making the Brooklyn Bridge, some people were feeling what's called a decompression syndrome. That means that there's a change in pressure. So imagine that beach, but instead of being on top of the beach that I told you to start imagining, go deep in the water very quickly and come up to the surface very quickly. So that is a change in pressure, and some people get sick from it. Now, there was also a something called Caisson disease, and that was another vessel, another story of a person getting central nervous system signs by being in a capsule. Just imagine a person in a capsule, in the water, or a cave, boom, and getting central nervous system signs, getting dizzy, getting neurologic, etc. And very important to understand that the early chambers did not actually have oxygen; they only had air, and that's still the way. That's still the way today. A lot of them do have air. Ours is 100% oxygen. Now, in the fast forward to the 1930s, the British Navy started to give inhalation oxygen to the divers. Remember, when you dive, when a person dives in the ocean or a lake, they're not breathing oxygen. All right, what's in that air is mostly air, not pure oxygen. Some people think it's oxygen, but it's not. Now, in the 60s, the hyperbaric chamber became now a standard treatment for decompression syndrome. What's decompression syndrome? A scuba diver goes in the ocean, goes really deep, start coming up, and they start getting bubbles around the skin. That is a decompression syndrome. They feel dizzy, they feel itchy, you name it. So, having said that, the research has started. Now we know in the 1950s that we can actually treat patients with oxygen. For example, we started treating patients that develop bone necrosis from cancer patients. Those patients were starting to get treated with oxygen successfully, okay? Successfully. Now, check out this cool story. I love this story. This guy, Borima, he took a bunch of pigs and he removed all the red blood cells. And then he put them in a chamber, oxygen hyperbaric chamber. And he kept them alive, not for minutes, not for hours, but he actually kept them alive for 24 hours. So he put a bunch of little piglets without blood, without red blood cells, but with blood, just remove all the red blood cells, and he kept them alive for 24 hours. That's called the Borima study. You can Google that. And that became revolutionary now because obviously he started to prove, well, an animal does not need blood, right? They don't need red blood cells. They were actually surviving fine without it. Now, then after that, we keep evolving and we show that we can use hyperbaric oxygen chamber for wounds. And even more, we start noticing the scientific, proven by science. What does it do? It has started to increase vascularity. So why does it increase vascularity? Because it actually also increases stem cell production. So now we're starting to understand in the 70s all the conditions that we can treat. There's actually, by the 70s, 125 medical conditions that were understood and approved to be used for oxygen hyperbaric chamber. Then after that, started the battle between is this going to be approved by insurance or not approved by insurance? And in the United States, everything has to do with health insurance. If the health insurance doesn't approve it, then it becomes a problem. So in the people business, only 15 conditions were recommended for insurance reimbursement, even though I already told you that 125 conditions benefit from the use of the chamber. And these are the ones that qualify for reimbursement today at this time. So that means that if you get any of these diseases, I hope you don't, but if you get them, you can request to your doctor to get oxygen hyperbaric chamber and the insurance will reimburse for it. So these ones include air embolism, carbon monoxide poisoning when there is a big fire, clostridial myositis, compartment syndrome and crushing injury, decompression sickness, we already talked about, arterial insufficiency, anemia, abscesses in the brain. I want you to see this again, abscesses in the brain. If there's anybody of my team here, I want you to look at these abscesses in the brain, because recently we actually have a patient with an abscess in the lungs, and the referring veterinarian did not want to treat it for with hyperbaric oxygen chamber, which would have recovered that horse so quickly, but they actually don't know the science. So if anyone in my team is here, feel free to take a picture of this slide, because abscesses in the brain are 100%, not 100%, they are approved for the insurance to actually be reimbursed. So you can use this information to help our patients, right, and help our clients understand these type of things. Because if an abscess in the brain can be treated, imagine one in the lungs. Obviously, it can be treated as well. So, necrotizing soft tissue infections, osteomyelitis, we already talked about, radiation injury when patients have cancer and they continue to get sick from that radiation. What compromised graft and flaps, what does that mean? It means that if you have a skin graft, you get a skin graft from a pig or from another person, you give oxygen hyperbaric chamber, and the animal actually recovers a lot faster. If there's a big wound and you graft it with the own tissue, it will actually take, it will revascularize a lot easier after oxygen hyperbaric chamber. That's why we promote every wound to get in the chamber, because it will increase very quickly. And the 14 is very interesting. Hearing loss, acute hearing loss, that's also approved to be reimbursed. So let's go to some important concepts. One, how does the hyperbaric oxygen chamber work? We're going to talk about that. Then we're going to talk about atmospheres. What does that mean? And then we talk about tissue partial pressure of oxygen. So what is it? It's a high dose of oxygen that goes through the nose or the mouth. So it's inhaled, and then that is delivered to the tissues in the bloodstream. So it doesn't really get absorbed, even though the horse is there in a chamber. It doesn't get absorbed through the skin. It doesn't get absorbed through the hair. It needs to be inhaled. So it has to go through the nose into the lungs, because that's the best way for oxygen to get into circulation. And then after that, the pressure that happens around the body is what diffuses that oxygen into the plasma. So the pressure, the animal breathe it, or the person breathe it, gets into the lungs, and then squeeze, like squeezing an orange, like getting juice out of an orange. And that will get oxygen into the plasma, massive amount of oxygen into the plasma. And that's why those pigs were able to survive, because the oxygen doesn't necessarily go in the red blood cells, it actually go in the plasma, in the liquid portion of the blood. Now, there are three types of chamber. One is the class A, which is for humans, and the only reason I'm telling you this is because there's a class C, which is for animals. Most people ask me, hey, can I go in the chamber? Can we put a bunch of people in your chamber? No, because our chamber is class C, which is obviously not approved for human. To be approved for a human, it needs to be a class A or B. Believe it or not, a class A is called multiplace, which means you can put a lot of people in it, versus a class B is monoplace, and you go as one person like this, all squeezed together without moving much. And this is an example. You can see right here in the picture how I'm getting ready to get my suit, and a bunch of other of my friends. This is when we were getting the certification, and we were in that chamber on the right hand side. This guy is closing the door, and we're right there receiving a treatment. On the left is our chamber, Equine Performance Innovative Center, and that is for animals, not for people, but for animals. Now, the next definition, next concept, atmospheres. What the hell is an atmosphere? We're going to talk about ATA, which is called for absolute atmospheres. So there are three types of basic concepts in pressure: above sea level, at sea level, like the beach I ask you to imagine when you're in the sun, or below sea level. I'm gonna go more into that, but there are gonna be some names and numbers throughout the presentation that I want you to that you're gonna remember, that I want you to know it means the exact same thing. If I ever say 1 atmosphere lowercase, one atmosphere lowercase, that is the exact same thing as 760 milligrams of mercury, which is the exact same thing as 14.7 psi, which psi stands for pounds per square inch, which is the exact same thing as 33 feet of seawater. So all of these are equivalent. They are all similar. Now, in my opinion, the only confusion in the whole hyperbaric oxygen chamber or hyperbaric chamber treatment is that there are two types of atmospheres, and that could be confusing. You just have to bear with me. One of them is going to be the ATM or lowercase, and the other one is going to be talking later, the ATA upper level, uppercase. Yeah, uppercase right here, ATA. So atmospheric ATM is atmospheric pressure. So that is when when you're in 5th grade, 7th grade, and you start learning that there's actually a column of air getting over your head, putting pressure on you. That's atmospheric pressure right there. Now, the gauge pressure, I don't even want you to think about it right now, but it just means it's a calibrated pressure at sea level. So we're going to pretend it's 0. That one is going to be 0. But it's calibrated. It's kind of a fake pressure because we know that at sea level we are not at 0, right? We are not floating in the air. There's a column of pressure in our head, which theoretically is 14.7 pounds per square inch. Now, absolute pressure, ATA, that's a total pressure that we put a horse in the chamber. Total pressure that we put a horse in the chamber. I know it's confusing, but I'm about to get you in 2 seconds. Just give me 10 more seconds. I'm going to read this for you. In hyperbaric chamber terms, ATA stands for atmospheres absolute, which is the unit used to measure the unit used to measure pressure within the chamber. So 1 ATA represents the standard atmospheric pressure at sea level. That's all you need to remember. That whenever I talk about 1 ATA, that is standard. Here we go. This is the representation, so you can understand it. If you are skiing on top of the mountain, you are actually lighter. You know that? You technically weigh less. You weigh less. The higher you go in the sky, the less you weigh, the less pressure there is on your head. Now at sea level on the right, we're going to pretend that is 0. 0. And then when we go at 33 feet below the water, we're going to talk about 14.7 pounds per square inch, 14.7 psi. Now, this is where it gets confusing, because if you're a mathematician, you might tell me, oh, but actually it should be 14.7 right here at the beach. I say, yeah, of course. But remember, we are adjusting. We are adjusting this pressure so we can understand better what's going on inside the chamber. That's the only reason I'm telling you, because I want you to understand what's going on inside the chamber. So inside the chamber, we are simulating. I know all this talk, all these 5 minutes of explanation to tell you the point. The point is that inside this chamber, we're stimulating this whale right here and this man. So just imagine that you are 33 feet below sea level, and that is going to be 2 ATA, 2 atmospheres absolute. That's the important thing, because that's what the chamber gauge will tell you. All right. So if you are 33 feet below sea water, that would be the equivalent of 2 ATA, or a treatment of 14.7 pounds per square inch. So that's pressure over your head. Have you ever dived into the pool and I don't know if your pool is like 5 feet, 6 feet, but you go in the floor and you feel like your ears want to explode and you feel some pressure in your head, that is how it feels about 7 feet. So imagine how much pressure it feels at 33 feet. So it's a lot more pressure, so that's why we adjust. And then when we are 49 feet of sea level, 39 feet below water, now you're at 2.5 ATA or 22.05 pounds per square inch. And now once in a while, very seldom, we have a horse that is very, very sick, that has a very bad bone disease. And we have to put that horse at 66 feet below sea water. 66 feet, which is 3 ATA or 29.4 pounds per square inch. Imagine the pressure that goes into that body, into that bones, so that oxygen is real diluted all through the plasma. What we have proven over and over again, and more of our research shows us, is that there's not a whole lot of need to go to 3 ATA. Most of the things can be solved between 1.5 and 2 right here at 33 feet of below seawater. Right? All right. So that now so far I have explained what is a hyperbaric oxygen and what is ATA. Now I'm going to tell you what is tissue partial pressure of oxygen. Tissue partial pressure. So, do you know that when the oxygen that you're breathing right now, when you breathe in and out, you are breathing only 21% oxygen. So in the air, there's only 21% oxygen. The rest is nitrogen and other gases. But it's actually very little oxygen what you are doing. William, you have a question?
Yes, and I'm sorry, I'm trying to connect the camera, but
No, I got you off. I turned you off. It was me.
and then when you consider like a deep bone disease or any lesser lesion to use the highest 3.0 atmosphere, what kind of let me see. Oops, I have to start your video. Gotcha. All right, thank you. So what you consider like to use the maximum high pressure that we have in the clinic?
We have only done it in navicular bone infection because the bone was rotting and it's very hidden. There is quote unquote less blood supply to those areas. So if you imagine some areas of the body like the skin has a whole lot of blood supply, and some bones like the long bones in your arm has a lot of blood supply. But the little bones like the sesamoids and the navicular bones, they have little blood supply. So that's when we have used the 3. It's actually not very nice to use because it's really bad on the seals of the chamber. It creates a lot of pressure.
Excellent.
All right.
Can
Good.
I
Yeah.
ask a question really quickly? I don't interrupt anything, but where is time a factor in when you're putting whoever, whether it's an animal or a human being? Can you state for the pressure by, you understand what I'm trying to say?
Yeah. Good question. The research in humans has been maximum about 60 to 90 minutes in the chamber. Now in animals we have reduced it between 45 and 60 minutes. So right now the Hyperbaric Chamber Society doesn't have any proof that being more than 60 minutes causes any benefits.
Okay.
So we have been reducing it to about 60 minutes most of the time.
Got it.
Very good question. Yeah, because you could say, oh, theoretically you could live there, or you could say, okay, it could be dangerous to live there. So it is not. You could get oxygen toxicity, but it's very rare. Very rare.
Got it. Thank you for answering that.
Yeah, absolutely. Look at this science, these laws. I am not going to get into these laws. Do not worry about it. All these laws are telling you, all these physics laws are telling you is that when you take oxygen and you put pressure on that oxygen, that oxygen in that body has oxygen and that liquid, and you mix the liquid with the gas together, and you put enough pressure, you're actually going to dissolve a lot of that gas in the water. Does that make sense? You're dissolving gas in the water. Why is that law important? Because plasma is mostly water. So we take advantage of that law and we dissolve all the oxygen of that gas in the plasma. Therefore, we don't need red blood cells, or we don't need a lot of blood vessels to take the oxygen into the tissues when there's damage. That's why these laws are important. So you can see that they really thought about this a lot. I mean, Boyle's law, Charles' law, Gay-Lussac's law, Pascal's law. There's even more. Dalton's law, Henry's law, you name it. So if you are actually going to teach this, like I do, you don't really need to know a whole lot of this, a whole lot of these laws. They could be actually more confusing, but this is a cool one. The Henry's law. The Henry's law is similar to what I was just telling you, that the amount of gas dissolved in a liquid is directly proportional to the partial pressure of that dissolved gas. So basically, the more you dissolve the gas in that liquid, and the more pressure you put on that gas, the more you can dissolve it. And that's why some people that are doing diving, they can get nitrogen narcosis, because the nitrogen now has different type of pressures, because what's in air, I just told you, only 21% oxygen. The rest is nitrogen and other gases. So now the nitrogen is going to build pressure and get out into the cells and causes toxicity. And that's what happens to the divers. They get a bunch of nitrogen in the cells. So let's think about the gas law at work. Let's think about it for a little bit. Why does this globe float? The only reason this globe floats is because we heat up the air. And what happens when we heat up the air? It expands. And what happens when the air expands? It becomes lighter, quote unquote lighter, and it goes into the sky. If by any means, and this is what we use in the gorilla. This is for those of you who saw the gorilla of the Magic Kingdom gorilla that came to us. This is what was happening. There was a big bubble, like this balloon, in the intestines, and we use this law to shrink the balloon. So if you put pressure from the outside in, what's going to happen to the balloon? It's going to shrink. And that's how we were able to fix the gorilla, because we were able to eliminate that bubble in the intestines by using hyperbaric oxygen chamber. Okay, good. So in order to understand how it works in wounds, we have to I needed to explain you that, because otherwise you wouldn't know how the gas gets to the wound. How does the gas get to the wound? It's not in the blood vessels, it's not in the blood cells, it's actually diluted in the plasma. So take this case for example. Look at this particular hoof. How difficult would it be to get blood, to get any oxygen there? Some people think, okay, if you put oxygen from the outside in, it will do a lot of wonders, which it would do some, right? You could do ozone bagging in here. You can put ozone around it and it will dissolve inside that. But the more effective one, it go from the inside out, because where are there more blood vessels? On the part that we see, or the inside of the hoof? Of course, the inside of the hoof. So we take advantage of all those blood vessels, and we flood it with oxygen and diluted oxygen, and then we bathe all that foot with oxygen. And that's why we like the hyperbaric oxygen chamber. This is another explanation of what I was just telling you. The red blood cell carries oxygen via hemoglobin. And just for fun, imagine this is a hemoglobin molecule. That hemoglobin molecule can only carry four oxygen molecules. So we have limited, very limited spaces. It's like very limited space. It's like going to school in the morning, but the school can only have 5 seats, and you have 50 kids to go to school. And the same thing in this case. You have a lot of oxygen to go, but you have very limited hemoglobin. So if there is no blood vessel and if there's no red blood cell, how are we going to get oxygen? There's a big stop in there. Because this is what it looks like in real life. Right now, when you are breathing in your blood, wherever you're sitting in Florida, your blood is carrying hemoglobin, and that hemoglobin is carrying 4 molecules of oxygen. No more, maybe less if it has some disease, but definitely no more. Cannot do anymore. So we are very limited. So if you are lucky, there's about 0.31% of oxygen diluted in that plasma, just a little bit. Now, if you put a mask with oxygen in your face, 100% oxygen, now you start diluting that air that I was telling you, that oxygen, you're going to start diluting in the plasma. And right around here, you have maybe about 2%, 2.0%. So there's going to be a little bit of molecules of oxygen hanging in here. Now, let's use these laws and let's take all that oxygen and pressurize it. So we use the law that says that a change in pressure causes directly proportional change in the partial pressure of the oxygen inside the blood. And let's dilute it in with Henry's law, bunch of physics. Don't worry about that. But this is what happens. Now you have 4.4% of oxygen in blood, 4.4%, which is a lot better than 0.3. It's actually 600% more oxygen. So when you dilute oxygen in plasma and you put pressure, now you have 600% more oxygen in the plasma than if you're just sitting at that beach standing without doing anything, just breathing air. So that's how this guy was able to keep those babies alive, because they did not need red blood cells. These pigs lived perfectly fine without red blood cells because all the oxygen was hanging out right here in the plasma. Make sense? Good. So how can we take advantage of this? How do we use that? Well, it's very easy. We take advantage because look at this wound over here. This particular wound, there's no oxygen. What is the partial pressure of oxygen over here? It's going to be 21%, right? Any oxygen here is going to be 21%. So we could take advantage of it because we know that these tissues are around here, all around that wound, including that bone that you see here, is under severe hypoxia. There is very little oxygen, so it's severe hypoxia. So what is the treatment for hypoxia? It's actually hyperbaric oxygen chamber. Treatment for hypoxia is oxygen. Hypoxia means low oxygen. So we have low oxygen. The treatment for it is chamber oxygen. Question, Willie?
Wait. Got it now.
Okay,
So does that also, it helps with the device named EpiFlow?
EpiFlow. So what EpiFlow was doing is these guys invented a device that put oxygen from the outside in. So increase oxygen from the outside in, low levels of oxygen from the outside in, which is really good, right? But what did I just tell you? I just told you that there's a lot more chance to get oxygen in this area if you go from the inside out. So the cool thing is that now we know this, we know that both of them work. So we could do oxygen, we could do ozone bagging here, or we could do hyperbaric oxygen chamber, and we can combine both of them. Now there's a debate about, and this goes back to Gigi's question, what is the benefit of having so much oxygen? Because once you put this particular horse in the chamber, the oxygen in this area is going to stay elevated for 2 hours. There is not enough research to tell us, should we do actually 24 hours of chamber? Should we do it multiple times? So what we do is empirically, by empirically means we make it up. By making stuff up, we decide if we're going to put that horse multiple times in the chamber. So we know for a fact that this horse will keep 2 hours, we keep high pressures of oxygen here for 2 hours. So theoretically, we can put that horse back in the chamber 2 to 3 hours later. And that's why sometimes we put a horse in the chamber 2 or 3 times, because we know that the oxygen goes down after 2 hours. Now, look at this particular case. This is a horse that decided to get out of the gate, usually on a Sunday, right? On a beautiful Sunday evening when nobody's watching them. They come out of the gate and a truck hit him. When the truck hit him, he slid in the road. As you can see here, the horse was sutured, but this black area show what? Severe hypoxia. Anything that doesn't have oxygen becomes black, right? So a lot of hypoxia over here, not a whole lot of oxygen. And what's the treatment for hypoxia? Well, it's oxygen. So these are perfect example of how we can use all these laws and put this horse in the chamber and they start healing very nicely. Now, one of the biggest nightmares for equestrians is proud flesh in the limbs. That's one of the biggest nightmares, because for some wild reason, horses love developing proud flesh in the limbs, and they love to take forever. We actually did a control study with a similar case, and a horse that has a proud flesh in the metacarpus, and we did one with a chamber and one without a chamber, and we were able to prove that we decreased the healing time by 50%. Using a control study. So for sakeness of time, I'm not going to go super deep into this, but all I want to show you here is the role of oxygen during healing. Why is oxygen so important during healing? For example, there is an injury, and right after the injury happens, there has to be a clot. How does that clot form? With platelets. So platelets do that. And that happens right away, within minutes. Then between hours to 3 days, you have all the other blood cells coming up. You have the whole army of blood coming in and getting into that wound to clean up, get bacteria out, to get more healing, and to start creating what's called a scaffold. I want you to think of like a skeleton. All right. Then that's the inflammation phase. It's like the army coming in to clean up. Then you have the proliferation phase, which is when you start getting that proud flesh, because you get new capillaries, new collagen, you get fibroblasts, and you get a whole lot of other stuff. And this is very weak. This has about, I would say, about 30% of the normal strength. But then after that, the maturation phase, which could last a year or 32 years actually, is when the collagen starts getting stronger and stronger. But the thing about this is that it almost never becomes 100% like it was before. How many of you had an accident or a wound or a scar? That scar always always there. The darn scar reminds you of that day that you fell, or that day that you forgot to take the knife by the right place. So that scar is always going to be there, and you always feel it, because that tissue never becomes 100%. It is 80%. When you add oxygen to all this and you have good oxygen, then you start speeding up all these processes, especially the proliferation and the maturation phase. You start speeding it up. So I told you about this, and here there is a very important thing, which is the production of peroxide. You know, back in the days, my grandma, every time I get caught or I get a wound, which was about every other week, she would put peroxide on all over me. Hey, let's clean up with peroxide. Let's clean up with peroxide. Why? Because oxygen peroxide is actually produced by the cells to kill bacteria and to create a real nice environment. So we're actually helping the body kill bacteria and improve the immune system. So this is what it looked like after this wound completely dehisced. And then we are using the advantage. We know that here there's not a whole lot of blood vessels right here between this end of the wound and this end of the wound. So we have to actually go from the inside out. We know that oxygen is soluble in plasma, and we know that oxygen actually is 600% more higher quantity in plasma when it's under pressure. And we also know that this tissue around here has a low oxygen concentration right here, low oxygen concentration. So we use all that science that I'm telling you. We use all that science that I'm telling you in order to bring oxygen to that area. The same thing here. We need to improve capillaries. We need to build brand new vessels, because right here there's no blood vessels, and the horse needs to live, and the wound needs to live, and the bone needs to live, and the bacteria needs to die. You can even see here parts of the joint capsule, which has very low blood circulation. So the best way to do this is to actually increase that chamber treatment, increase it with oxygen chamber treatment. And this is for the scientists and the veterinarians. What are the effects that it does? It increases phagocytosis. What does that mean? That army that's coming up from the same body start eating away the bacteria. That's why it's antibacterial. That's why it's so good for infections, because it helps the immune system attack the bacteria. It also we also know that some bacteria hate oxygen. So if we hate oxygen and we actually give them more oxygen, then we're going to kill that bacteria, right? We also know for a fact that some of these toxins will be neutralized when there's oxygen around. In addition to that, we know that the chamber makes antibiotics stronger. They make them work better against antimicrobials. Why? Because it increases the ability of the body to kill bacteria. So all that happens with the research proven that the hyperbaric chamber does that. So it amazes me how some people just continue to not understand and not believe on it. What else happens? It has vasoconstriction effect. So if you have a horse with edema, with cellulitis, a horse that gets in an accident and has intracranial pressure, like if you ever get in an accident, hit your head, and you have a stroke or you have some sort of a brain damage, put you in an oxygen chamber. It actually reduces that edema and prevents long-term damage, long-term permanent damage. So what does it do in stem cells? There was a study in 2006 out of a University of Pennsylvania that showed that there is release of stem cells from the bone marrow 100%. 100% more. Not a little bit, not medium, but a lot. So when you put a horse in a chamber or a person multiple times, it will increase the amount of stem cells circulating in the blood. Very important. And why is that important? Because that's how you repair wounds. We have seen at Epic that we have several cases now that they have eye ulcers and a lot of problems with the cornea. We know that those corneas don't like to heal well sometimes, but when we put it in the chamber, they actually heal very, very nicely. Why? One of our beliefs is that there's more stem cells circulating in the blood. All right. So, what are some of the sort of the side effects, which we have seen very little? One of them is barotrauma. What does barotrauma mean? Barotrauma means that the pressure can hurt the lungs, or the pressure can hurt some internal organs. We've never seen it significant enough in the horses. We have done over 3,000 cases by now, and we really have never seen it. Confinement anxiety, that could happen. That's very real. And we can put these horses in with dermosidan every time they go in the chamber. And oxygen toxicity, we just have never seen it. It's so rare, but I guess it could occur. They report that it could occur in people. They could get a little bit of some central nervous system signs, some dizziness, etc. But we just have never seen it. Now, why do we get barotrauma? Imagine that you go diving, because this is what's happening in the chamber. You're diving very, very, very fast. Imagine that there is not enough time to compress or decompress, and you're just going really fast. There's so much pressure around you that imagine that you are going in a plane, and all of a sudden you feel the need to equalize your ears, but you can't. That pressure that builds up, that could give you a headache, or it can give you like an ear pain. That's because there's changes in blood, there's changes in the gas. So if you come up really fast, like you're flying up in a plane, if you go imagine going really fast with no time to decompress, that could actually burst something inside your ears, inside your middle ear. So that's why you could theoretically have barotrauma, but we have been so the science is so well developed that we really have never seen it happen. So what would happen to a patient? Let me see. I have some questions over here. Mirta wants to have another treatment already. Mirta, we get to that question soon. I like the question right away. So what would happen?
Bring it.
What would happen to the gas as the patient comes to the surface? So imagine this patient is deep in the ocean and is coming up. So as the patient comes up, it's the exact same example as I told you with the plane. The gas expands. So if there is a pocket somewhere, theoretically, or the patient holds his breath, that gas is going to expand. Let me paint the picture to you. Horses don't hold the breath, so this is why it doesn't happen much. So let's say you hold your breath very tightly and you're going up in the chamber. You're basically coming to normal pressure. That air is going to expand or contract. Going to expand. And that could cause pressure, that could cause some of the lungs to actually burst out. Some alveoli in the lungs could burst out and cause trauma. I've heard it's quite painful. We have never had it happen, and it's very, very rare because a bubble can get trapped in there. So what's the treatment? Back in. You have to put them back in the chamber. So if that's what happens, you just put it back in the chamber and decompress very slowly. Easy fix. Easy fix. Oh, here's an example. As the patient goes down, the air bubble shrinks. As the patient goes up, the air bubble expands. So that's why it happens. Good. We sedate most of our patients, like I told you, and confinement anxiety is common in horses. That's for sure. Here we are. Some of the oxygen toxicities or some of the side effects that have been reported in humans. We're talking about oxygen toxicity, convulsion, nausea, dizziness, hiccups, muscle twitching, abnormal vision, difficulty breathing, or unusual fatigue. If that happens, you might have to go back in and decompress properly. We do get hiccups in horses once in a while, especially when we go to 3 ATA. So, 8 minutes. Let me walk you through some cases, okay? Look at this. This is the horse that I show you. This is one of the patients I show you. This is before. This is 5-day evolution, 15-day evolution, and look how it looked after 30 days. Now, something you need to know is that this horse went home 2 weeks after treatment, because you see right here, it didn't really need anymore. It was already healthy. The stem cells were already flowing, and everything was really good. So this horse got laser and hyperbaric at the same time. And this is how it evolved. Very nice, right? How about this one? This is the one that I was telling you. This could take a year or more. This is a horse that got a laceration in the paddock, in the fence. Laceration, it blew like that. It became non-healing. And very quickly after that, after 18 HBOT, we were able to actually get it to close. The reason I don't have the very final video is because the horse had to go to London to compete. So I lost the patient. And look at this one. This one, you see the wound in December 2018. This one was treated in the house at the farm without any hyperbaric chamber, with just bandages and some TLC, bandages and TLC. And this is what it looked like in March 2019. And this is one of the Lichoa's patient right now, and I bet you she still has a little scar in there. This is another one. Look at this particular one. This one was treated without the hyperbaric chamber. This is how the injury happened. You can see the horse on the left. You can see how he's put his leg through the wood, right? And this is how it looked like right after. Then it became this big by November. And look how it looked still in the summer of 2017. I mean, we're talking about a year. This is when I tell you, I can tell clients, hey, these things can take a year or more if you don't actually treat them properly. Now, this particular horse here on the right, let me give you the right. Does it work in bones? How does it work in bone? I already showed you how the Army and Navy and the armed forces use it for bone necrosis, right? And one of the biggest complaints I get from veterinarians around the country and the town is like, hey, the chamber doesn't work with bones. That there's so much evidence, it's overwhelming. They just don't show us that evidence in vet school. But check this out. This particular horse right here on the right, this horse is the first horse, is the horse that I showed you with the bad fracture. Dr. Madison at Ocala Equine did an amazing job trying to put it together. But more than 99% of these patients never make it. They have to be put down. But this horse actually made it and did real good. It didn't go back to racing.
I'm sorry to interrupt you. Is the same image go to the last slide, please? This one. It is the same horse. The images of the same horse.
Yeah. It's the same horse as the very first one that I showed.
Gotcha. No, I'm just looking at the EP and the lateral view.
Yeah, if you want to, this case is also presented in our equinearthritis.com, if you want to see more about this particular site. It's actually equinearthritis.info. I write it here. So the equinearthritis.info. info/fedlock. Right there we have that case is very nice. Thank you, Atalicho, for answering to Mirta. Good. So we have multiple papers that show actually 74 scientific papers with 67 positive. The osteonecrosis is extremely well treated, extremely well behaved, and carries a better prognosis when it's combined, when the treatment was surgery and HBOT is combined. So how does it do it? I'm not going to bore you with it, but basically we have angiogenesis. What does that mean? Increase blood, right? Increase blood, angiogenesis, increase blood production. Reduction of fibrosis to minimize scar, and increases stem cell production. We went into this a little bit already when Gigi asked the question. We could go on it, we could be doing it every day, we could be doing it 2 times a day or 3 times a day, and we know that sometimes every 2 hours can be done. We just don't do it. In our hospital, what limits mostly is actually the manpower to run the chamber. Otherwise, we could have the chamber running 24/7. Check out this case. This is a case with chronic laminitis that lasted for several months. Chronic abscesses. The interesting part about this horse is that it belonged to an 82-year-old lady, sweet lady, 82-year-old, and she was changing the abscesses, the foot bandages for months and months and months. And the poor thing was just not getting any better. And she was so sweet, and she loved this horse so much. You can see that this horse could barely walk, right? And look at the laminitis. This horse is barely hanging in there. You could see that that bone really wants to get out. You can see the severe laminitis. And here you can see a very nasty abscess from this horse over here, and how it went to this horse ended up actually going to the bone, and we ended up combining 37 hyperbaric over the period of 3 months with this horse. 37 hyperbaric treatments. And look at him when he was ready to go home on the right hand side. This is a 28-year-old animal, okay? 28-year-old animal. I know the videos sometimes don't translate very well, but you can see how good he's running on the right hand side. Now, of course, this horse didn't just receive hyperbaric chamber, but I don't need to tell you that a horse with this severe laminitis and 28 with conventional treatment, it probably was not going to make it, right? So we ended up combining everything: Magna Wave, oxygen. We also did vibration plate, multiple treatments for this horse, obviously. So check this out. This is a 5-year-old Pasofino mare that developed severe laminitis right after traveling from Colombia to the United States. And I'm going to show you. I don't know why the machine is doing that. Right here, look how she arrived. Look how she couldn't barely stand, right? She could barely move. And this one was in the hind end, which is actually not very common. Look how she just cannot, she put all her weight in the front. All her weight in the front. Miserable, right? And then she starts walking. We put some boots on her, we did some chamber on her, and then she started walking a little bit. Some progress after a month. And these are her radiographs. And this is her after. Right here, look at this radiograph. And that's pretty intense, right? That's quite intense. You can see that that bone really wants to come out. So we put in the saltwater spa as well with the vibration plate. with the hyperbaric chamber, with the therapeutic chewing, with the proper nutrition, and 4.5 months later, she was actually trying to trot. Look at this little baby right here. So not a very common disease that actually gets treated and positively. Recently, we have a horse that Dr. Lichoa showed me today, and she will be added to this presentation. That horse came a very similar case as this, with the bones pretty much out of the foot, and the horse started. They showed me a video of her jumping today and doing amazing. So this is a really good one. This is one that fractured her shoulder. Right here in the picture, you can see a fractured shoulder. If you see that line, you zoom in, you can see that line of the scapula fracture. And this is how this horse presented. Now you might not see it right there, but I'm about to show you how deep this wound is. You can see that she's not moving her leg, right? But look how big that wound is. We suture it, we closed it, and we put it in the chamber. And this is her walking. This is how good the chamber works, because it really, remember what I told you, it puts compression around that edema around the nerve, edema around that fracture. And some of those you get pretty quite interesting results almost immediately. Now here's a fracture that Willie was talking about. Right here. It's not a fracture, it's fractures, right? This is a fractures. And this is the repair. This is what the repair looks like. It's like putting a bag of ice together. Thank you. It's like imagine a bag of ice broken, right? And be carefully picked up together. And this is what it looked like. And here's another one. This is the navicular bursa infection that I was telling Willie. I know we're almost out of time, but I'll show it to you real quick. This horse came, and you can see this horse we have it on YouTube. This horse received 3 surgeries before she came to us. And she received the strongest and strongest antibiotics before she arrived. And this is how she arrived.
That is Willow, right?
The interesting thing about this horse is that she spent 6 weeks like this at another clinic because they didn't believe in the chamber. Spent 6 weeks like this, surgery after surgery, and the horse was not getting better. The owner's a helicopter pilot, so she had some understanding for the Army, helicopter pilot for the Army, so she had some understanding of how the hyperbaric chamber helps. So she came to us and she begged us to treat her. And then we put her 2 times a day at 3 ATA. And this is how she did after the 3rd hyperbaric. We changed absolutely nothing on this horse. We kept on the same antibiotics, we kept the same chewing, but then she started putting weight on it. And then 2 weeks later, she started putting a little bit more weight on her. And then she just continued to improve slowly, continued to improve. And this is how she looked 26 days after. And if you go to our page, equinehyperbaric.com, you're actually going to see her trotting and galloping and just racing. Oh, here it is. And look at her. Right? A horse that would have never recovered. She would have never, ever, ever recovered. She was actually very close to be put down. She was recommended to be put down. That's what she came to us. Good, guys. Well, I think this is a great time to stop. I kept you over for about 6 minutes. I have tons more. I can speak about this for ages. So if you have any questions about the hyperbaric oxygen chamber, you can always call us and ask you. You have more lectures in your program that you can learn about it. And we also obviously have a web page that provides a lot of information. And yeah.
I have I'll ask you my question later at another time. I know everybody has to go. I just have one question about the actual program. I know I'm approaching module 3, and a lot of the vaccinations, fecal ed count, all of that. It says, for example, internal parasite management and recommended schedule lesson. So do I schedule a lesson with you ahead of time so that we can talk about the lesson every time I'm done?
We can review that. I can get with you on that. Have you done it yet?
No, I have not done.
Go do it first. Do it first.
Do them, go through.
Yeah, and then we can discuss it over here because that's a really good topic I would like to discuss on a class.
Okay.
So discuss it so we can keep banging on them because that's becoming a very hot topic right now in the industry.
Awesome. Will do. And then any questions later, I'll ask you.
Yeah, absolutely.
Thank you so much for this lesson. I think this is my favorite.
Oh yeah, good. I'm glad. I love the feedback.
Excellent. Thank you, Gigi.
I think Mirta, did you ask me to talk about bone bruising? Was that you?
That was not me, no.
Was Mirta. Okay, I have it on the list. I just haven't prepared the lecture yet, but I will prepare you a nice lecture on bone bruising, okay?
Awesome.
All right, guys. Good to see you. Have a great night.
Everyone.
Have a nice evening. Thank you.
Bye-bye.
You too.